Well, welcome back to Virginia this morning. Virginia will enter phase 3 of the state's Forward Virginia reopening plan, scheduled to start next Wednesday, July 1st. In this segment, Andrea spoke with a doctor about what you can do to prepare in case of a spike of COVID-19 cases this fall.
Multiple sources predict a rise in coronavirus cases in the near future. Dr. Robert Posner joins us today to give us his best tips on preparing for a second wave. Hi, Doctor.
Hi there. How are you today?
I am doing well. Thank you so much for being with us. This is, of course, something that we're all concerned about, especially as people start to leave their homes for employment and for summer and a number of other things. So we want to talk with you about the potential of what we need to do to prepare for this second wave that may be coming our way as early as the fall. So tell us a little bit about what you expect and how we can best manage these different elements of our lives.
Yeah, I don't think there's any doubt that the virus will come back in a second wave in the fall. And we clearly know now the data as to what makes people at high risk for the COVID virus reinfection and serious disease.
You mentioned a portion of this certainly being tied to weight and the importance of maintaining blood sugar and blood pressure in ways that are healthy.
Yeah, the data is very clear, Andreas, about what causes potentially serious disease with the virus. Obesity, high blood pressure, and poor blood sugar control are the major risk factors for developing serious disease.
Absolutely. And what we find, especially in speaking with other skilled professionals like yourself, is that health is really a multi-pronged approach. And so in addition to managing weight and blood sugar and blood pressure, we're also looking at things like maintaining mental health. What tips do you have for us there?
That's very important. Mental health, good sleep, good nutrition, all that works together to improve the immune system. So a self-assessment to see how you're doing with your own mental health, what's your level of body, depression, how are you sleeping, all these put together with your health parameters really make for a much healthier person going into that second wave.
And there's a stress factor to all of this as well, especially as you think about the amount of time that we've been spending in our homes, probably more than usual, managing what may be a different diet than usual, and also different sleep habits or a different schedule and structure. So when we look at rest and relaxation and the importance of that, especially as we look at the amount of stress that we're feeling from not only COVID-19, but also other current events that we're experiencing, what should we do to make sure we're getting the right amount of rest and relaxation?
Now, stress, Andreas, can deplete a number of very important chemicals in the brain and body, and several of those chemicals are serotonin and cortisol. So during these stressful time periods, it's important to maintain the right nutrition and the right vitamin intake to ensure that these chemicals like serotonin and cortisol are under good optimal control.
And you mentioned vitamins. I mean, we all know that we need vitamins and minerals, that our diets tend to be deficient in certain ways. Which ones are the most important that we need to have as we look at COVID-19? And how do we make sure we're getting enough, but not too much?
Sure. Well, we've seen the data from the COVID-19 infection, Andreas, is talking about something called cytokine storm, which destroys lung tissue. Vitamin D has been shown to be effective with that. High doses of vitamin C have been shown to be effective for the immune system. And there are things like serotonin, echinacea, and elderberry that have been shown to be helpful to the immune system.
That's very helpful. I mean, those, just quick facts that will help you start to look at nutrition labels and make sure that if you're not getting enough, that you are supplementing in the right ways, especially as we look at things like elderberry, which has certainly made a surge in popularity in recent years. So when we think about COVID-19, we often think about the lungs and lung performance. So you have some suggestions as well on what to do to make sure that we are maintaining the health of our lungs.
Sure. Well, obviously, cigarette smoking by far and away is the most serious thing you can do to hurt your lungs. But there are a lot of people that have, Andreas, mild cases of bronchospasm where they might have low-grade asthma and don't know that. So good lung function also involves sleeping well, too, because at night, if people have sleep apnea, that's also a negative lung issue, too.
So as you mentioned before, it's all connected. You've really got to look at health, from a holistic approach, making sure you've got a great diet, that you're managing your rest, relaxation, keeping your stress level down, certainly looking at your diet and your weight, exercising, etc., to make sure that you've really got a good system in place to be healthy when this new or recurring virus comes back around.
Absolutely. It's the physical part of the body as well as the psychological and mental health of the body. So putting it all together, the more we optimize our physical status and mental status, the more we'll be prepared to defend ourselves against the virus on the second wave. And there will be a second wave.
Well, thank you so much for being with us. That is key information, things we can do right here, right now, today to prepare. Thank you so much.
You're welcome. Thanks for having me.
If you'd like to learn more about what you can do to prepare, please visit our website, WTVR.com/VTM.